I think we do a pretty good job of kind of creating the space as an organization to identify new ways of doing things. And part of that is I've got a panel at 1:30 that's about it's about performance dashboards, but to me it's more about our strategic goals as a state. And I think we're pretty good at this, and the governor has led this idea that we kind of set ambitious goals that represent like a real impact for citizens if we were to achieve them. So around violent crime reduction or greenhouse gas reduction, whatever that might be. And when I say ambitious, like they're really ambitious, and a lot of people would advise them to like not set goals like that, and certainly not be transparent about how you're doing. But we do that anyway, and by setting a kind of a big ambitious goal, you do at least two things. One is you orient the kind of the machine of state government around a common purpose. And the second is you kind of create this space where you need to be innovative. So you can't just keep doing things. So if you want to reduce violent crime in the state of Maryland by 20% in the next 5 or 6 years, you can't continue to supervise people who, like violent criminals who are on parole and probation in the same way that you've always done it, because then you're not going to make any progress. And so you need to think of new ways to do that. And so that's kind of what I'm talking about when I talk about creating this space where we can come up with new solutions. One of the great things we've done is we've built, I believe, the first in the nation health information exchange. And so what that is now is it's a consortium of all the 47 acute care hospitals in the state of Maryland. And they all share admission, transfer, and discharge data. So if you go to Johns Hopkins Hospital and then a month later you go to University of Maryland Hospital, you know, Maryland is able to see that you showed up at Hopkins the previous month, or that you had surgery at Kernan a month prior to that. And then it's also an infrastructure to be able to start sharing more data. And then by enabling that, you also end up with this big data opportunity, which is now you have records of every hospital admission, transfer, and discharge in the state of Maryland. And you can start to include stuff like what the diagnosis was. You can integrate it with billing data, so you can see what services were provided. And you're starting to collect like really robust information that gives you a picture of health in the state of Maryland. And so we're starting to think about how do we leverage big data opportunities like that. How do we create common platforms around these things that are important to us, so that there's not you know, a crime system that shows warrants and where people on parole and probation live, and then another one that shows where your crime is, and another system that shows where your calls for service are. We want kind of one common platform. And again, that creates a big data opportunity. And then there's obviously the open data component to that too, which is of that information that we can make publicly available. How can we do it? And I'm starting to think more in terms of how can we do it to simply, I spoke to some people, I had kind of a small dinner with the tech and business community in Baltimore a few weeks ago. And one of the things that we talked about was how I'm fortunate to work with a bunch of like really smart, hardworking people in state government, and they're kind of all throughout. But there are not a ton of us, and there's just not, and so there's certainly not a ton of us when you compare that to the number of smart, hardworking people that are in the state of Maryland, who are interested in some of the same issues and outcomes as we in state government are. So I'm trying to think more about how we enable citizens and businesses to kind of use some of the information that we have to come up with their own solutions, or make some money, or create some jobs, or like whatever that might be. And so that's something we're really trying to think about. We're a very data-oriented state government, and that kind of comes from the top down. It's been the governor's sort of trademark ever since he started doing things like CityStat and CompStat back in Baltimore in 1999. So state agencies are very inclined, they're very comfortable with the idea that they collect a bunch of data about their own performance, whether it's you know, how many like of a certain service that they provide, or whatever that might be. We have reams and reams of that stuff. We've always made that public, just not in like a really smart open data way that other people could use it, but we're making progress on that now. So there's always been this culture around being very data driven and being very analytical. You know, around innovation, it's like I said a little earlier. I mean, I think it's this idea that by setting some ambitious goals that are very transparent, it orients people around a common purpose on this stuff. And then it also opens up this space where you need to do something kind of new and clever and maybe creative in order to make some progress on stuff. So we just came up with, it's the first time we've ever done we've added a goal to one of the governor's strategic goals. There were 15, now there's 16th. And the 16th is to have full employment for our veterans, and we define that as 3% unemployment by the end of 2015, I think. So that's ambitious. To get down to 3% unemployment for veterans. It's probably somewhere between 5.5% and 6% now. And it involves the Department of Veterans Affairs, the Department of Labor Licensing and Regulation, health, you know, our National Guard, our partners in the Department of Defense, like all of these different kind of state agencies, private sector folks, nonprofits, feds, all have to work together on this stuff. And so again, they're oriented around it, but we need to think of new ways of doing things, because that's a difficult thing to achieve, to cut your unemployment rate for your veterans in half. But we have a mechanism. I mean, state stat is part of that mechanism, and that's something, a performance measurement program that the governor started on day one. But that's always been an opportunity to regularly kind of come together, have the critical people in a room, and to talk about, you know, basically get a report card on your performance and to try and figure out how to make some more progress. And that's very much beneficial to an innovative culture, because you get your budget folks, your legal folks, your governor's office folks, your departmental experts, what I would call my subject matter experts on things like unemployment, veterans, all the rest of that stuff, in the room together regularly, talking around a common set of information and trying to come up with strategies that maybe you wouldn't come up with if everybody was in their own corners.